Hi, Dr. Dayanaev is here from Steinway Family Dental Center. We get a lot of questions about dental implants, so today we're going to answer some of those most common questions about dental implants. The first question is, what are dental implants and how do they work? So, dental implants are basically screws that replace the roots of the teeth. So they're replacement only for the roots of the teeth, but they can support the teeth on top of them, like the crowns portion of the teeth. They can support that, and it looks like you have your own teeth and you can use them. They're very functional. It functions just like your own teeth. Of course, you have to take care of them by cleaning and so on. And they're stronger than your teeth, so you do have to be careful with them so you don't overpower and bite through something. Next question is, who is the good candidate for dental implants? Dental implants basically designed for people who missing teeth. If you missing one or multiple teeth, then you would be a good candidate to have dental implants. Of course, there's requirements for that, and you would have to have a sufficient amount of bone where the implant would be placed into. So implant needs to be supported by bone, believe it or not. And that can support then the coronal portion or the tooth itself, right? Tooth is what we see, the root is what we don't see, but that's what supports the tooth. So the implants are basically replacing the roots and it will support your teeth. Also, we can say that who is the ideal candidate based on age on this. So based on the age, the ideal candidates would be somebody who is over 18 years old and under 100. So anybody in between 18 and 100 are good candidates for that. There are different medical implications. For example, somebody who's taking a medicine called bisphosphonates. Those are medicines for osteoporosis that is prescribed by the doctor. It is not over-the-counter medication, so the doctor would have to prescribe that. And the side effect of that medication includes osteonecrosis, so therefore the surgery or implants would not be recommended or would be a little more difficult to keep them in the mouth. It's not impossible. There are some materials that are available to still let patients who take this medication to implant procedure be available to them, but it's just a little bit more difficult to keep them in. Also, the age-wise, there's really no other restrictions other than this specific medication, or people that have right now undergo chemotherapy for cancer treatment. Again, the same thing. They may want to wait until the chemotherapy is completed and then they would consider getting implant replacements for their teeth. The next question is, what is the difference between mini implants and regular implants, right? The full-size implants. The mini implants are very narrow. So normally they're recommended as a temporary use for replacing teeth and what we call the temporary prosthetic devices while patient is waiting to heal for the more permanent implants to take place, and then we can get more permanent restorations on those permanent implants. Can they replace permanent implants and be used strictly only mini implants? The answer is no, because they will not last as long. They can't hold as much pressure on them, therefore most of them will be broken at a certain point of time. Usually half of it get left inside, the other half breaks up. It's not a product that is permanent, so that's your answer. The next question is, what is the dental implant like from start to finish? So let's assume that the extraction has been already done, the bone graft has been already done, and the site is ready for what we call osteotomy, or removing of part of the bone so the space is available for the implant to be placed. And of course, all the measuring stuff already done, the doctor already got his x-rays. He looked and he decided what size of the implant he's going to use and what diameter of the implant is going to be used in that case. Of course, all of this dictated by the bone and by the necessity to replace the tooth. What is he going to use to replace that tooth? How big it should be and so on. Will that tooth be supporting only one crown, or it would be part of the bridge when more than one tooth is supported by this implant? Then the doctor will remove part of the osteotomy after punching through the gum, or he would open the gum so he can visualize where the bone is, and then place an implant, and he would suture over it, or he would use the healing cap on it, so which will make the gum grow round around it, so it looks kind of like a whale when you look down into it, and or kind of like the gum grows around the tooth, right? So that's what it would look like, and with that you would wait between 3 to 6 months until it will fuse completely with your own bone, and only then there is not required for the second surgery. Then this healing abutment would be removed, and we would scan you with a scan flag that is specific for that particular implant, and then we would get more permanent product to it, like a crown that has this middle part of it that connects implant to the crown. And of course you get it all screwed in, and that's the end of it. You got yourself a tooth with the crown, right, and with an implant. Next question is, how long do dental implants last? Well, like everything else, it can last you a lifetime, but you do have to maintain it. You have to come and see hygienist every 3 months to get it cleaned up, and of course you yourself have to brush and floss it. That's all the questions we have about this subject so far. So if you have any more questions, you can send it to us at alldentalneeds.com, or you can just call us at 718-728-3314, schedule an appointment, and we can see exactly what you need in your mouth. And if you need dental implants, we'll recommend the best possible outcome out of your implant.